Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. How is everybody today? I hope that the week did you good. I see Miss Andrea in there. Is everybody able to hear me this morning? Long week, but you're good. I'm glad you are, Miss Andrea. Yes, I'm doing well. Everybody's ready to get that cardio on. All right, let's get some stretching, get your tea, all that. You guys know I'm going to give you 2.5 minutes for each scenario. I'll be watching you guys in the chat. If you guys get your answers in enough time, then I'll just cut it short and we'll head for that week. All right. Yeah, it's just 3 weeks. I know, Daryl. Hey, it is okay. You do. Congratulations, Daryl. Daryl's a new daddy. I'm sorry, though. I had to shout it out now. See, I'm a mama. Oh, my goodness. Oh, they're just adorable now. Daryl is a brand new daddy, a 3-week-old. Well, hey, you better turn that volume down because Auntie Tamika is a little bit loud. I get excited with this coding. Yes, Miss Andrea tells you congrats. And hey, from me to you, from your AMCI family, congratulations on your new one, Daryl. All right, so we're going to jump in here because Daryl's got to get back. I know he's got to help with that newborn baby. All right, guys, here we go. We're going to read this first, and we're going to start with your answers first. We have A, 88300, B, 88305, C, 88307, D, 88309. What is the code for gross and microscopic examination, surgical pathology of breast tissue from a simple mastectomy? All right, I'm gonna say 2.5 minutes, but I know it's not going to take you that long. So as soon as I see that pretty much everyone's got it, then I am going to go ahead and stop that timer. Daryl, you don't see my screen. Are you guys seeing my screen? You guys let me know if you're not seeing this screen, then that's a problem. Okay. Now, Daryl, click something because everybody's seeing the screen. I need you to maybe wiggle some cords around or come come back and come back in. You got to see this screen, new daddy. You got to see this screen. Let's see, maybe like I said, the only thing I can think of is maybe go out and come back in, but you should be able to see me, okay? Because we got to get you in on this scenario, young man. All right, so Daryl's out and he's gonna come back in. I'm gonna go ahead and let you guys jump right to it, okay? All righty, your time starts now. I'll be back. All right, guys, how we doing? I want to see a few more answers in this chat before we keep rolling along. All right. All right. If you hadn't got it in there, I'm still missing just a few folks. All right. So I'm going to give you just a little bit more time and then we'll get going on some explanation on how we get to this answer. All right. Let's see here. We got two. All right, I got one more person. I need you to slide your name in there. Yeah, see, when we do Saturday study session, and even if it's just me or even when I have company, it's nice because it's a little bit of a smaller group. We can address you when you're in class, but on study session, I try to make a point to keep my eye on all of you. So I see you. And I see you if you don't get an answer in there for me too. And you guys know now, I'm not gonna never call you out or embarrass you. I'm just gonna speak in general terms and say, I don't see an answer from one more of my fabulous students. All righty. So I'm going to give an explanation because if you're like I was when I would be in study session, I would kind of hold back sometimes, but hey, don't. Go ahead and put your answer in there, even if you're not sure, because it helps me to understand what I need to focus on. Okay. So remember that if you're torn, it helps me to see what you need. Okay. All right, so here we go. We're going to get to this one. This is your answer is going to be C. All right, so I'm going to show you how you get there. This is indeed a gross and microscopic examination. It is surgical pathology. It is the breast tissue, but it's a simple mastectomy. Okay, so when you get here, you have these various really like code families. They're separated by level, and we're looking for breast simple mastectomy. Okay, now you can go ahead and eliminate 88300 on site. It is a gross examination only, meaning it's simply a bare eye examination. So we already know you've got to take this one off immediately because they're referring to microscopic examination. So 88300, that's gone. All right. So let's hone in on these others. We're going to take a look at this code family here, 88305, this level 4. This is dealing with the breast, but here we're talking about a biopsy and a mammoplasty. No, we need this simple mastectomy. So 88305, no, going to take him away as well. We're going to take a look at 88307, this level 5. Yeah, breast mastectomy, partial, simple. Yeah, that's some good stuff right there. We're going to hold our place here and take a look and do our due diligence and continue on. Okay, so we're going to give it a light yes before we give it a firm one. All right, so we're going to hop down here to 88309. This is indeed a breast mastectomy, but this is with regional lymph nodes. Okay, so this one is a bit more involved. All right. And so this 88309, that's not it. And that takes us back to 88307. And that is our code. All right. So definitely make yourself a little note if you haven't already that that is for a bare eye examination. And then these here are all surgical and gross examination. But as you progress with the levels, what they're doing becomes a little bit more involved. I hope you can kind of see that. You're dealing with biopsies mostly here. When you get here, you have some biopsies, but the procedure could be a bit more involved because just think about it. A biopsy of the brain is going to be more involved than a biopsy of the breast. Okay. All righty. And then here we're getting even further when you start talking about dissections and resections. So this is the big daddy one there. All right. So it's everybody with me. Everybody's doing good. All right, I got some guidance, and many of you arrived at this one really quickly. So we're going to keep moving on and get on to our next one. We have A 81000 with a 26 and QW modifier. We have B 81002 with a 26 and QW modifier. C 81003 with a QW modifier. And finally D 81001. What is the code and any required modifiers or modifier for dipstick urinalysis automated without microscopy performed in a physician's office for a Medicare patient. All right, coders, you've got 2.5 minutes, and I know you got it. Your time starts now. All right, I'm just monitoring you guys in the chat, and I see you're getting some answers in here. I have just a few more of you I'm waiting on. I'm glad you're back, Miss Aisha. I know I had a temporary outage yesterday, and they were sending me messages. I'm like, no, 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 I need my internet. All right, I'm gonna give you guys just 1 or 2 moments more, and then I'm gonna jump to it. And for those of you who haven't gotten your answers in, I've got a sneaky suspicion it may just be those modifiers. And you guys know I stay on you with the modifiers because it can help to eliminate some answers. I understand how you feel. When I was a student, I was always like, no, I don't want to do a modifier. All right, so I'm going to go ahead and we're going to unpack this thing because I have several scenarios that I want to get to. So here we go. All righty. Yes, Miss Aisha, it is. Is the study sessions are a huge help when you are taking the exam. And oftentimes your study sessions will go like I would say a lot of the things you see, you're going to see something that's very similar. So that's why I drive concepts and stuff because naturally it won't be exact, although every now and again you might see something exact. but all of the different scenarios that we give you and the concepts, you are going to be well prepared. Just continue practicing, and you can even go and you can look at some of the prior study sessions that some of the other instructors have done, and it will be a just, I tell you, it's gold. That really helped me to solidify the concepts in my learning. So I know it's going to help all of you. So this investment you're making on Saturday, it will be well worth your time. All righty, so we have the required modifiers for this dipstick urinalysis, automated without microscopy. And this is in a physician's office. It's for a Medicare patient. Okay. All right. So you guys know I'm always honing in on making sure you pay attention to these various headings, the various sections, because it's like your GPS. It gives you that overall view and lets you know if you're in the right neighborhood. And so indeed with the 81000, this parent code, this is good language here. It is urinalysis by dipstick or tablet, but the issue becomes the language that's specific for the parent code. Okay, so you guys know I'm always driving this because I don't want you to miss something because you think if this is wrong, this whole family is. This is a family. So you know once you see this semicolon that you need to start looking below because there are dependent codes and they're dependent on this common language, which is everything that precedes this semicolon. Okay, so I'm always reminding you of that. So while 81000 doesn't apply, this common language, yeah, this is good stuff. It does, because this isn't non-automated with microscopy. This is automated and it is without microscopy. This is everything that this scenario is not, except for that common language. Okay, so yes, automated without microscopy. So that one's gone. All right, and look, we're going to look down here. This 81001, it's automated with microscopy. This is without. So we're going to take that one away as well. Now we have 81002. It is non-automated without microscopy. So that part is good, but this is indeed automated. All right. So that one's gone. Just that quick. All right. So then we're down here to the 81003. It is automated without microscopy. All right. That is our code. All right. So that's why I always tell you, don't get tripped up. All right. If you have this like blocked off or however you need to do it, however you have it chunned, you see just how quickly, boom, 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 you're there. All right. So, you know, I like to give you tips. All right. This 26 modifier, it is performed in a physician's office, but with a 26 modifier, it's not required because it's performed in the doctor's office. The doctor's office, the staff, the equipment and everything, they are providing this dipstick. Okay, so they're not offering any type of professional services. It's performed in the doctor's office. So when you see that and you see a 26 for something like this, you're not going to need it. Okay, and these, when I give you little pointers like this, these are different things that I have in my chun and had in my chun to keep me straight. Like, hey, if I see a 26 and they're doing a dipstick and they're saying they're in a physician's office, yeah, I don't need that. That's gone anyway. Okay, and without, even with this one, you didn't really have to know much about the modifiers because the codes drove it. What about with this Medicare patient and this QW? Well, let me let you in on something. That modifier, that QW, that clear, it must always be applied to a Medicare claim, and this is a Medicare patient. Okay, so just little tips like that, different things to help you. This one, it didn't matter, but you may encounter one that it does make a difference. Like they might have this and they might have it with the modifier, or they might give you an 81003 without it. So that way you could get to it. Okay. So let's see. Isha, I'm gonna get to you with that one. All right. I'm gonna write it down. And then you know I always answer you. Okay. All right. We're gonna keep moving with this next one. All right. So we have A 82040, 82247, 82248, 84075, 84155, 84460, 84450, 82565. B, 80076, 82565. C, 80076. D, 80076 with a 22 modifier. A patient presents with right upper quadrant pain, nausea, and other symptoms of liver disease, as well as complaints of decreased urination. Her physician orders an albumin, bilirubin, both total and direct, alkaline phosphatase, total protein, alkaline aminotransferase, aspartate aminotransferase, and creatinine. What CPT code or codes is or are reported? All right, my terrific coders, you've got 2.5 minutes and your time, it starts now. All right, guys, we are getting down to the wire on this one. I'm giving you guys just a few more moments for some of you to get your answers in there. And then we're going to go ahead and unpack this thing. Let me take a look one more time and see if I've got most of you. Yeah, we are ready to roll. All righty. So let's go ahead and unpack it. All righty. Ms. Tamika, you were spot on this one, okay? My hand was trigger happy because it's just me back here. So you are good, lady. All righty. All right, so here we go. We're going to unpack this thing. Your answer is indeed B, and I'm going to tell you why. All right, so here we go. You guys already know this person has symptoms of liver disease, and they're going to order a function, a liver function, which is hepatic. You guys who have hung out with me in midterm before, you guys know, see, looking at this, why we need to know these terms. So hepatic is indeed liver. All righty, so that's exactly where we need to be. This particular one, we can just take a look at some of our FTRs that are related to organ and disease panels. Okay, so hepatic function panel is indeed what they have ordered. All right, and so I don't know if you guys have chummed this section, but I love how Mrs. J presents it. She's like, for each panel, you want to write down how many there are because there's certain instances you can simply count, all right, how many uh, different tests are run within a panel. All right, so with this one, we have bilirubin. We see that one, and we have total and direct alkaline phosphate. We have total and direct bilirubin right there. So that's three of them. We have this phosphatase, all right? Phosphatase total protein, all right? We've got there. There we go. Hold on. That shouldn't be like that. It should be alkaline phosphatase, and you see that. Then we have the total protein, all right there. And then we have the transferase aspartate amino alanine. So we have that one, and then we have this one too, the transferase aspartate amino. So we've got 7. All of them are there. Okay, so we're gonna put a little almost we're sold on this one, but before we sign off on it, we've got to take a look at what's going on with the scenario to be sure. All right, so indeed, when you look at your FTRs, yeah, all of these tests are performed. So yeah, we could use that panel. All righty, so we're gonna put a little star by that one. But he had also ordered that creatinine, and so yeah, we're gonna have to, according to our FTRs, we're going to have to report any additional tests separately because it's not included in that. So we're going to just code it by itself there. All right. So we're going to put a soft yes on that and take a look at what is going on with A. And you guys already know all of that's bundled. All right. So no need to separate it out. So we would code this. We wouldn't list it out like that. So we would take that off the list as you guys have done. I'm going to take this one off the list because it's missing the creatinine. That needs to be listed separately. All right, this 80076. All right, we can't add a modifier 22 to increase the service. It's like we're saying, oh, but we have one more test, so we'll do a 22 on there. No, no, no. You have to list the specific test out separately. And you guys obviously already know that because everybody did outstanding on this one. All right, so for that one, you guys already know that your answer is B. All right, so we're going to give these some firm yeses, and you guys did amazing on this. All right, so we're going to keep on trucking because I want to squeeze some more in here. All righty, as much as we can. So, hey, before we silence, before I silence myself, I'm going to read you out with the next scenario. We have A, 82940. 82947, 82947 with a 91 modifier. B, 82947, 82947 with a 76 modifier. C, 82948, 82948 with a 91 modifier. D, 82948, 82948 with a 76 modifier. A 35-year-old type 2 diabetic is feeling weak. The physician performs a stat glucose test in which a finger stick is done placing the drop of blood on a regent strip. The test indicates the patient is hypoglycemic. The physician gives the patient some glucose supplements and performs another stat glucose test using the same lab test as before 30 minutes later. The second test shows the glucose levels return to normal. How are the lab tests reported? All right, coders, you know how we do it. You've got 2.5 minutes and your time, it starts now. All right. I see you guys in there. You guys did outstanding. All right. Everybody got this thing correct. So I'm going to move through this thing and just briefly touch on these modifiers, which I think you guys have gotten. But hey, I always say in explaining it, if I can give you just one little morsel of something to either add to your chun or something, then we've done well. But you guys did wonderful. So obviously, you guys knew which keywords to pull in, and some of you even jotted down the keywords that you use to drive you all to the right answer. So I'm loving what I'm seeing. This is what we're calling getting ready for that exam. That's the name of the game. All righty. So here are our keywords. We've got that stat glucose test. It's a finger stick, drop of blood on a regent strip. The patient was hypoglycemic, so the doctor is going to perform another stat glucose test, the same lab test, and then we're going to report what that second test showed. So stat glucose regent strip. All right. So yeah, glucose, that's what we need. All right. So that's good. But with this code, all right, this parent code, the common language is good, but the language that's specific to 82947, yeah, this is saying accept the region strip, and we used a region strip. So yeah, that's not going to work. So we automatically going to take off A. All right. We can go ahead and take off B as well. All right. So already we've got a real good shot there. We've got it at 50-50, and we aren't even 30 seconds into the scenario. Here we go. It is a glucose. It is blood region strip. We know that. Drop of blood, region strip. All right. I like it. Okay. So the thing that we have to figure out is that modifier. They indeed performed another one. All righty. So we just take a look at the modifier. So the 76, it's for a repeat procedure or service. All right. And indeed, that's not what happened. We had a repeat clinical laboratory diagnostic test. It is just that simple. All right. So, because we had that, we need the 91, and it's telling us it's the same laboratory test on the same day. We know it's the same laboratory test. It tells us same lab test as before, 30 minutes later. So we know it's on the same day. All righty. So that's how we got to see just that quickly. All right. You guys were smoking in there. All right. I'm loving it, loving it, loving it. Okay. So, and you can see how that modifier just boom, 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 getting back there. I always would look in the back of the book. Sometimes I look in the front, but I always I liked having a little bit more to know I was in the right place. But that's just me. Sometimes I could be extra that way, but you just want to be sure you're going through quickly and efficiently, and that you guys are doing. I'm seeing it. All right. So we're going to keep it moving on the next one, making sure you guys understand how to get to that answer quickly with these panels. We have A 80050, B 80050 with a 52 modifier. We have C 85025, 84443, 82040, 82247, 82310, 82374, 82435, 82947, 84075, 84132, 84155, 84295, 84460, 84450, 84520, and D 80050 with a 22 modifier. All right, a physician orders a general health panel. All tests except a creatinine, including CBC with automated differential. What CPT codes is or are reported? All right, coders, I know you're ready for this. You have 2.5 minutes, and your time, it begins now. All righty. If you haven't gotten your answer in, I need you to go ahead and slide it in there before we start talking about it. All right. Let me give you guys just a little bit more time for those of you who are still working. I have just a few of you that I know are still giving it a go. And I certainly appreciate you guys' effort because, like I said, I know it is no small feat to give 2 hours of prime time on a Saturday morning. So I tell you, it speaks volumes of your commitment, and I've got to make it well worth your time. And that is my goal. All righty. So I think I've gotten an answer for everybody. All righty. You right, Andrea. It isn't like we can go a whole lot of places, is it? Or at least we shouldn't be all that mobile, right? So my husband and I tag team, like, okay, I went to the grocery store last week. You go ahead and get in there. I'm sitting in the parking lot as soon as they open. I'm almost about to go in there and help them stock. Okay. So here we go, guys. We are gonna jump right to it. I had just a few of you on the fence with this one, and I'm gonna help you make that firm decision and clarify it for you. We've got that general health panel. Had all of the tests except that creatinine, which is including this general panel is including the CBC with automated differential. All right, and your answer is indeed C. Yeah, it's C. It's like for real. All righty, so the general health panel. All right. This I always kind of understood it, and then it depended on the day. All right, so I'm going to break it out for you. The general health panel, which many of you, it was kind of a split, but most of you were on it. And for those of you who slightly missed it, you're on it too. You're probably looking at it the way I used to as well. So here we go. We've got this general health panel, and it's including this comprehensive metabolic panel. All righty. But the issue with this comprehensive metabolic panel is that it's the scenario is telling us we're doing everything but that creatinine. All righty. And you guys remember, if a code is not included in that panel, just one is not there, can we use it? Can we use that particular code? All right. That's right. Okay. And I believe that that's right. I want to be sure that everybody is different ways you can look at it, but I want to be sure everybody was driven right to that point because that's going to help you eliminate a whole lot of stuff really quick. Okay. So again, panel codes, they can only be reported if all of the tests in the panel are done. If any test is left out, in this case, that creatinine is not included. So we've got to code each test individually. All right. All righty. So we're going to take that one off, 80050. And here we go with this 52. That 52 cannot be used. All right. Because you can't say a 52 because it's reduced. You can't make it right that way. So you wouldn't put that on there. So that's gone. We can't increase the procedural service by saying, well, we're almost there. But no, it's got to be, it's all or nothing. All right, with these panels. All right, so automatic, it's gone. You can't make it right with the modifier. So that's really the trick. You can't increase the service. You can't decrease it to try to account for something that's missing. So indeed, at this point, we have to code each test from the general health panel, which is here, the general health panel, which includes the comprehensive metabolic panel, and it includes these others. It's either these or these. All right. So we've got the complete blood count, CBC, which is 85025. We got that. All right. Or this one. And then here, we always have the thyroid stimulating hormone. All right. So we've got that one. And so make sure you know when it says this or this thyroid is always in there. It's these that you're looking at. All right. This complete CBC automated and automated differential, or it might be the blood count complete automated and appropriate manual WBC. Okay, so this is the or. All right, but this thyroid is in there. I thought I'd just point that out to you because that used to trip me up sometimes. I don't know why. Just the wording was funny to me. And then automatically, we've got all the rest of these. We're just clicking them off. We've got that bilirubin, we've got the calcium, we've got the carbon dioxide, we've got the chloride, we've got the glucose, we've got the phosphate, we've got the potassium, the protein total, the sodium, the transferase, ALT, and the AST, and we've got that bun. All right, so we've got it all in there. Every last one of them we had to code, but of course we didn't have to tick them off. I'm just showing you just in detail how to get there, and you guys did amazing. All right, so we've still got time to do yet some more in this particular section, and we're going to hop to it. All right, so here's your next one. What is the code or codes for thawing 4 units of fresh frozen plasma? Yes, I did read the question first. Okay. All right, so we have A, 86927, B, 86927 times 4, C, 86931, D, 86931 times 4. All right, coders, as always, you've got 2.5 minutes. I don't believe you're going to need all of it, so I'll be monitoring the chat as usual. And your time, it starts now. All right, all right. It's unanimous. I knew you guys were gonna get this one. And hey, yes, you will see some like that on that exam that you're looking around the room and going, is that it? I mean, like for real, that's all of it. Hey, go with it. Leave nothing on the table, y'all. Nothing on the table. Everybody already knew it was B, so we're just gonna quickly go through that thing. Yeah, we're thawing some fresh frozen plasma each unit. So you guys caught it. We're gonna need that multiplier. Okay, we've got to account for each, and we've indeed got 4. Alrighty, and for 86927, yeah, that's not enough. All right, we've got to add a multiplier. Okay, so that's why that one's gone. Code is good, but we don't have that multiplier to account for 4 units. Alrighty, the other one, it's fresh frozen blood each unit. And what do I always tell you? If that parent is wrong, then the dependent is wrong. If this common language, all right, that's the key. If the common language of the parent is wrong, then the dependents will be wrong as well. So always remember that if this common language is wrong, everything that falls underneath it will be wrong as well. So you can quickly eliminate that. You don't even have to start looking at it. Yeah, it's throwing it, but it doesn't matter. This is coding for blood specifically, but if this is wrong, anything following up under it, it's going to be wrong too. And so we already know, yeah, that's it right there. We need 86927 times 4 to account for the 4 units because it's saying each unit. And you guys already knew that. That's what I'm talking about. Y'all gonna have me crying over here. It's like seeing your children grow up. All right, guys, here we go. I want to squeeze this one in before we go ahead and move to the next one because there's a lot of good stuff in this one, okay? So we have A, 88329, B, 88331 with a 26 modifier, 88334 with a 26 modifier, C, 88331, 88332 times 2, D, 88331 with a 26 modifier, 88333 with a 26 modifier. Dr. Lee performed an intraoperative consultation on a bile duct tumor requiring frozen section and cytological evaluation to a bladder tumor. How would you report his professional services? All right, coders, I know you got this. You have 2.5 minutes and your time, it begins now. All right, guys, I was giving you guys a little extra time. Some of you had enough time to go back and kind of rethink this one. This one was a little bit tricky for some of you guys, but with a little bit of a nudge, you guys got it. So great catch for those who caught it, and for those of you who still need just a slight nudge, we're gonna get it done for you. And I see really a lot of you guys were on the fence between B and D. All right. And so, hey, this is always good stuff. This is where you want to get clear on things. Okay. So always know that you guys are doing great. A lot of these things you're getting correct and you're where you should be. And then I try to put some in here, not so much to trip you up, but to be sure that you're clear on things. And I can tell that you guys had narrowed it down to B and D. Okay. And so that's a good place to be in. So we're gonna get you over the fence. So if you see anything like this, you're gonna be clear on the exam as well. Okay. You won't forget it. All right. So the answer is indeed D. And you guys got there once you realize, yeah, B, that's it. Okay, maybe that's not it. All right. So you got Dr. Lee. It's going to come in and do an intraoperative consultation on that bile duct tumor, requiring that frozen section, the cytological evaluation of that bladder tumor. All right. So we're coding for his professional services. And so, indeed, we are going to need that 26 modifier. Okay. So, how many specimens do we have? We've got the bile duct tumor and the bladder tumor. So, we know we've got two. And then what was done? We've got that frozen section and the cytological. All right. All righty. So we're going to take a look at these codes. We've got the 88329. Indeed, we did have that pathological consultation during surgery because it's intraoperative. All right. So that's good. It's just not specific enough. Okay. So this common language is good. All right. It's everything before that semicolon, but it doesn't have anything specific afterwards. So we're going to take that off the table because a bit more happened during that consultation. So we have that first tissue block, a frozen section. Yeah, we have that frozen section right there, that frozen section, that bile duct tumor. It's for that single specimen. We only had one. So that 88331, yeah, that's good. All right. And we see it's in all of them. All right. So, all righty, there we go. So we're going to hold that. We don't have any additional blocks. Okay, we only have one frozen section because the next thing is a cytological evaluation. So the 88332, wherever we see that, that one's gone. So now we're at 50-50. All right, so these two are the same. They do have the 26 modifier for the professional services. This one does too, but here we go. This is the thorn in the side right here, this 334 and 333. All right, both are cytological examinations, and this one is the add-on. It's for each additional site. Okay, so this is for cytological. All right. We only have one. So we use this 334. We can use it in conjunction with 331 and 333. So that's good. All right. This may have thrown you. When I first read it, it threw me a little bit for intraoperative consultation. And none of these do not reports don't apply. And that one doesn't. For this one, for that intraoperative consultation on a specimen requiring both frozen section and cytological examination, we use the 88331 and the 88334. Okay, yeah, that's the one, Tamika. Yes. Look, when I was preparing, I was like, wait a minute. Okay, look, it's for a specimen. All right, so this would imply the same specimen. It's one specimen that you say if you did a frozen section on this bile duct tumor, a frozen section and a cytological um, evaluation. But we have two different specimens. Okay, so that's why be clear the number of specimens. If we only had one and that was done, then yeah, that's what we would use because it would it this is what the parenthetical guidelines are telling us. But no, we didn't have an additional site for a cytological examination. We only had, so we take that one off. We only had the cytological examination from the initial site of the bladder tumor. Okay, so that was the sticking point. Okay, so that is why. That's it. And you guys already knew the professional component was needed because it's telling you Dr. Lee's coming in. We're coding for his professional services. Okay, so we know that the 26 modifiers needed. That wasn't the sticking point. It was this verbiage in between here. And the key was recognizing, yes, I have two specimens. They're coming from two different places. I'm only getting one single specimen from each one. This one says single. All right. This one, instead of single, it says initial. Okay. So that one may have thrown you too. You could, if you want, if it helps you, you could put in parentheses single specimen as well, because initial site. All right. So we're going with that first site, and then anything additional. Okay. We use that add on code, but we only had one. So there you go. So, how is everybody doing? Was that the sticking point for everybody? Let me see you in the chat, because, like I said, I can see y'all. We're a little tight knit study group today, so I got my eye on all of you. I typically do, but I'm able to put both of them on you. All right, so I'm hearing from Andrea. I see Tamika. Yes, 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 yes. Box that initial site. That's right, Aisha. All right, so how are you, Miss Renita? Are you good? You, Daryl? Look, you are a trooper today, because I know maybe that baby's still sleeping, but boy, oh boy, I remember. Yes, so you are good. All righty. Miss Tracy, are you good? Yeah, I know y'all are just like, really? She really is seeing all of, yes, I see all of you. Okay. All right. So everybody's good. All right. So we're going to keep on going. We're going to go ahead and jump into the next section. So give me one second here. I'm just going to freeze that screen and move on down. And we are going to head on into medicine. Let's see here. That's what I need right there. All right. So we're going to head on into our next section. All right, we're going to do some immunizations. All right, Daryl, you're going to be a pro with this new baby. Okay. All right, so we're going to start. I'm going to read your answers. We have A, 90707, 90716, 90471, 90472 times 3. B, 90707, 90716, 90460, 90461 times 3. C, 90710, 90460. D, 90710, 90460, 90461 times 3. A young child received a mumps, measles, rubella, and varicella, an MMRV injection at a neighborhood clinic with provider counseling. What CPT code or codes are reported? All right, guys, you got 2.5 minutes, and I'll be monitoring the chat. And your time, it begins now. All right, guys. I almost got all of you in there. I'm giving just a few extra moments in there. I want everybody to get in on it, and I like to see what may have been a sticking point for you. So then I know where to drive that answer. All right. So I'm going to go ahead and unpack it. Thank you guys for everybody getting your answers in. And like I said, I like to see it regardless. It helps me to know where to focus. And most of you were teetering between two answers. Okay. So and to make sure you're clear so you guys get every last one of these types of questions correct on your certification exam. Your answer is indeed D, and like you said, it was split. Several of you were on the fence on it, okay? And then you knew why after you got that little nudge, okay? So this is an MMRV, all right. And so for code 90707, this is an MMR. We are missing that varicella vaccine on that one. All right. So 90707 is only for that one. So we're going to take that one off. All right. So we're going to continue on. All right. We have the MMR. Okay, that's all we've got. And then we've got the varicella vaccine. They're trying to add it that way. Okay, but that's not it. So you could have immediately taken it off. Okay, with the 90707. If it's wrong here, it's wrong here as well. Okay, so if you're wondering, like, well, man, why am I going back and forth? Remember, we're always going to code to provider certainty and specificity. And if you have a combination code, then you're not going to separate it out. You're going to code the code that is the combination code. And this 90710, it has it all. So you wouldn't separate it out. Okay. So just want to drive that point. All right. So we know we're going to use that. All right. So now the issue becomes really the one that's not in common. How do we account? What's going on with this 90460? All right. So we do know that applies to both. All right. Because this is face-to-face counseling, any route. Doesn't matter if it's IM or sub-Q. We're going to use it. It's for anyone that is 18 years and under. We know that they are because this is a young child. All right. So this code is coding for the first or only component of each vaccine or toxoid. All right. So this is the sticking point. This is the sticking point, y'all. First or only component of each vaccine or toxoid. Well, we already know immediately when you see that this is a combination vaccine. We've got four different units in it. Okay. Four different things going on, four different types of vaccine in there. Okay. So with this 90461, we have to remember when we see each additional, then you start thinking multiplier if it's needed. Okay. And in this case, it is. All right. Each additional. So we've got the mumps, we've got the measles, the rubella, and the varicella. Okay. So for that first code, that's going to take care of the mumps, okay, but we're missing the additional vaccines with this one, so that's why that one's in there. And this right here is telling you, and particularly if you've listened to that lecture, Mrs. J tells you one way you can kind of get a little inkling of what's going on. All of it's in caps, so this is telling you this is a different vaccine: measles, mumps, rubella, varicella. Okay, so we've accounted for the 90460, but what about those others? There you go. Those parenthetical guidelines, they're going to steer you every time. We're going to use this 90460, but when we have multiple combinations, we are going to use it in conjunction with the 90461 because we have multiple components. All right, so we got a code for each additional component, and that's how we get that multiplier. So there we go. We got the vaccine, the MMRV, all right, and then we've got the mumps, and then for those additional, all right, then that's where we get the multiplier there. All right, so you guys, you got it. They're your components, and this is the administration. Okay, and you should have those things. You got a code for the components and the administration, so you should have that somewhere on your page when you start zeroing in on vaccines and things to to guide you so that you can get to where you need to go. So, how's everybody feeling on this one? Okay. Let me see. Let me see. I want to hear from everybody. How are you, Miss Andrea, Isha, Daryl? All righty. I've got Miss Janetta in there, Mary Rose, Renita, Tamika, Tracy. How is everybody? Everybody's got it? Okay, you guys are vaccine pros. I'm seeing some got it, some greats. I got it now. Yes, doing good. Yeah, I'm glad to hear that, Isha. I'm glad you're feeling pretty good. Pretty good, Mr. Mika. That's good to hear. All right, we're gonna keep on rolling, guys. We got lots of stuff to do. Yes, I know. I got some end-stage renal disease stuff for you. I got a good one for you. All right. So we're going to head in with this one. We've got A 94644 with the 76 modifier, J7609, J45.909. B 94664, J7609, J44.1, C 94680, J7609, J45901, and finally D 94640, 94640 with a 76 modifier, J7609 times 2, and J44.1. A 70-year-old patient with chronic obstructive asthma is brought to the urgent care clinic with increased wheezing and coughing. The provider initiated an albuterol inhalation treatment, 1 dose, delivered by nebulizer. After treatment, the patient's exacerbation was somewhat improved, but the provider determined a second treatment was necessary. What codes are reported? All right, guys. Just take it in, take a breath. You've got this. You've got 2.5 minutes, and your time, it starts now. All right, I'm waiting on a few more answers. This one got some of you, and some of you I can tell were on the fence, and that is quite okay. Give it just a few. All right, guys, that's what I like to see. I can tell when you guys are answering in the chat, and if then that's why I say get your answer in there so that I can give you a nudge if need be. And a lot of times it splits along like the same answers, or sometimes it'll be off. You guys are teetering between one or two, and then once you get that nudge, then I would say 99% of the time, then you guys get to where you need to go. So I appreciate you guys putting your answers in there, because again, it helps me to see where you are and what may have been the sticking point for you. So I appreciate that. So we're going to go ahead and unpack it, and you guys figured it out once you got that nudge. Okay. So the answer is indeed D. All right, we've got that 70-year-old with chronic obstructive asthma. The provider initiated albuterol inhalation treatment, one dose delivered by nebulizer. And after treatment, they were somewhat improved, but the provider determined, yeah, let's give this patient another treatment. So here we have inhalation treatment, one dose nebulizer. All right. So when we look at code 94644, this is continuous inhalation treatment with aerosol medication. Okay. And then they're talking about the first hour, but we don't even have to get that far. This is continuous inhalation treatment, and this is simply inhalation treatment via nebulizer. Okay. We don't have aerosol medication. This is nebulizer. All right. For acute airway obstruction. All right. But it's not continuous. Okay. We do have the aerosol, but it's not continuous. Okay. So we're going to take that one off the table. And this one really is just honing in on the keywords and being clear. All right. For 94664, this is demonstration and or evaluation. We don't even have to keep reading. We already know nobody was demonstrating anything. This patient needed some help breathing, and they received an inhalation treatment with a nebulizer. So 94664, that's gone. All right. So 94680, yeah, that's the wrong procedure. Oxygen uptake, expired gas analysis. Nah, we didn't see anything like that in there. So that one's already gone as well. When we look here, 94640, yeah, pressured or non-pressured inhalation treatment for acute airway obstruction for therapeutic purposes. Yeah, this is looking good. Yeah, inhalation treatment, nebulizer. Yeah, I like it. I like it. Okay, so our do not report codes. All right, none of those are going to apply. But here, for more than one inhalation treatment performed on the same date, we need that 76. Okay, so there we go. We had a second treatment, so that's why we got that there. All righty. And then for the J7609 times 2, all right, with that one, we have that one because that's coding for the medication. We know it's times 2 because they got a second treatment. And then the J441, that's for the obstructive asthma. Okay. So you guys did outstanding. Some of you were stuck here with the 94664. All right, with the B. All right, but you guys were clear once you realized, yeah, we're not going to be able to use that one. That's not it. Okay. So is everybody good? Let's see with your let's see. Oh, let's see with you know what, Daryl, they can, you know what, with chronic obstructive pulmonary disease, they have chronic obstructive asthma. Okay, so that's what we're gonna be coding for. what I would say is with the COPD, with COPD acute, and then they're having an exacerbation. A lot of times, a person with COPD, they're going to have issues with asthma as well. All right. If that makes sense, okay. So what I would say is, okay, let me just make it um let me just make it concise without going into clinical stuff. All right. If you're torn, what I still do sometimes, if I'm like, does that imply with does that go with that? Oftentimes that's why they give you these little cues up under here. The other thing you can do, and with this test always, because you see you can stay within your CPT manual for this exam, because that's what's going to drive most of your codes, unless you get into a situation where you need to break the tie. Okay. But with COPD, it is chronic obstructive pulmonary disease, but a person will sometimes have asthma as well. Okay. But you could possibly have to code it separate. I would say, if you put it this way, when I'm torn, I go and look it up. Okay. So if I'm torn about the asthma or chronic obstructive asthma, I'll go look it up to see, is that going to bring me to the same code in this book? Does that make sense? That way you're always clear. But you're not going to have to be doing that. That would be something to keep in the back of your mind. Hey, if you decide, say at work, or if you are going on and you start doing, other things and you need to know that, then I would say do that. Okay. That's what I do. Even if I'm coding a scenario or something, I'm like, am I in the right place? I'll go back. Even though you're given these codes, you're not going to have to be going to that index. But if for some reason you're curious and you're like, is this one of the same, and you don't see it here, then start from the beginning and look it up and see where it takes you. Okay. Does that make sense? All righty. Oh man, Miss Cheryl. Yeah, it's okay. Yeah, it is okay. All right, that's fine, Miss Cheryl. All right, so that's how we got there. You guys see it now. Okay, somebody needed the you need the first screenshot, Miss Tamika. Okay, let me uh give me one sec here. I'll just click back. Mm, let's see, you need that screenshot here. Let me put all the things back. Is that what you're wanting? Okay. All right. Let me put all your things in there. All right. If anybody else needed to grab it, then you can. And then we're gonna move on to the next one. So give me one sec. I'm gonna leave that screen there, and then I'll just pull in the next one while I'm putting that thing on pause, so you guys have time enough to get it. All right. So let me be sure I'm where I want to be. Yep, that's where I want. All right. So everybody good? All right. All right. I've got my eyes on everybody. All right, Miss Andrea, Aisha, Daryl, Janetta. Everybody ready to roll? Miss Mary, Renita, Tamika, Tracy. Is everybody ready to roll? All right, let's do the next one. I'm loving what I'm seeing. You guys are doing fantastic. And like I said, when we are in this little close knit group, I'm able to really hone in and address some things. And we can get some things done. Okay. And Daryl, if you still want more explanation, you let me know, and then I will give you more explanation via email. Okay. Because I always have a running conversation with one of your study buddies. She's always asking me something. She reminds me of myself when I was going through. I'm like, okay, I get it, but just this one more thing I need to ask you about. All right. So I know you guys are probably already working on this thing. I'm going to go ahead and read it out loud while you guys are considering how you're going to approach it. Okay. So we have A 90832 90785, F 84.0. B 90785, F 84.0, C 90882, F 84.0, D, 90791, 90785. F, 84.9. A therapist in a residential care facility works with a nonverbal autistic child age 4. In this session, the therapist uses drawing paper and washable markers. The therapist sat with the child and began to draw on a sheet of paper. She gave paper and markers to the child and encouraged the child to draw. The psychotherapy session lasted 30 minutes. All right, coders, you've got 2.5 minutes and your time, it starts now. All righty, you guys are already there. I'm loving what I see. It didn't take much for you guys at all. All right, so here we go. We've got A, and this was really just honing in on those key words. We've got the therapist, the residential care facility, a nonverbal autistic child who is 4. The therapist is going to sit with this little guy or girl and encourage them to draw. This psychotherapy session was 30 minutes, okay? So we have 90785. We're taking that one right off because that's an add-on code. I tell you, whatever you have that add-on code in the first position with an answer, that's a gift. Gimme, gimme, gimme. It's a gift. All right. So we're going to take that thing off. All right. So here we have 90791. Anybody know what this star is by this code? Anybody? That's like a bonus one, okay? I'm gonna let you guys answer while I'm talking. All right. We don't have a psychiatric diagnosis, a diagnostic evaluation that's psychiatric in nature. This is psychotherapy. All right. So 90791, nah, we can't do anything with that one. Okay. We're not doing anything with it. All right. So we're gonna keep on going, and we're going to take a look at code 90832 and 90882. All righty. So for 90882, environmental intervention for medical management, we don't even have those words in the scenario. So indeed, it is 90832, psychotherapy, 30 minutes with that patient. All right. So, yeah, psychotherapy, 30 minutes. I tell you, that thing is spot on. All righty. So, for this code 90785, this is for, it's an add-on code indicating interactive complexity. All right, so before you can ask me, I'm going to tell you because, see, that's how my mind worked and still works as a coder. What is interactive complexity? All righty, it is an add-on code. It's specific to psychiatric services that refers to communication difficulties during the psychiatric encounter. And indeed, this is an autistic child and they are nonverbal. All right, so that's why we're going to have this add-on code, interactive complexity. And also we're going to use this 90785 in conjunction with psychotherapy. All right, and here we go. There's our code right there, 90832. That lets us know we're in the right place. 90832 used in conjunction with 90785. So hey, we've checked it over and over and over again. All right, and so these do not report codes, those don't apply. And so hey, that's how we get there. And we already know this autistic child, that's why we're coding the F84.0. But again, you don't even have to get to the ICD-10 CM book because that CPT manual is going to drive your scenario. All right, so how are we doing? All right, yes, and that star is for telemedicine. All right, so hey, I just thought that was something to bring to your attention because right now, lots of telemedicine going on with everything that's happening. All right, and hey, I just realized, just a little sidebar, we were talking about the chronic asthma and the COPD. Okay, so I'm going to drive it home in another way as well. I have asthma, but I don't have COPD. And chronic asthma and COPD, they have similar symptoms, but they are considered distinct. Okay, so COPD, it's referring more to chronic bronchitis or emphysema or both. All right. Another difference is that asthma, it tends to occur in childhood and you'll see it in some adults, me included, and many others who have it. While COPD is more likely to appear in adults that smoke. Okay, so it's not to say a person with COPD can't have asthma. They could, but the conditions are distinct. Okay, does that make good sense there? I was like, how can I explain that to make it concise? Does that answer it there? All right, there we go. Okay, see, that thing was troubling me. Okay. I'm glad, Andrea. All right, here we go. We're going to keep on rolling with some more medicine. Okay. All right. We have for your answers A 99503, I 50.9, J 96.11, B 99503, I 50.9, J 80, C 99504, I 50.1, J 96.11, D 99503, J 50.1, and J 80. Zero. All right. A patient with congestive heart failure and chronic respiratory failure with hypoxia is placed on home oxygen. Prescribed treatment is 2 liters nasal cannula oxygen at all times. A home care nurse visited the patient to assist with his oxygen management. What CPT and ICD-10 CM codes are reported? All right, coders, I know you got this. You guys are just showing out today. All right, you've got 2.5 minutes and your time, it starts now. All right, how we doing, guys? All right, I see some more answers coming in there. All right, let me count all of my star pupils and be sure everybody's gotten an answer in there. If you're on the fence, put in there what you're thinking so I know what I need to drive home. You guys are just, oh man, I am so excited for you guys. I hope you guys know how wonderful you're doing. Okay, so for most of you, you got this right. If you were on the fence, I'm going to help you make the right choice. Okay, no worries there. This patient has chronic heart failure and chronic respiratory failure with hypoxia. They're placed on home oxygen. The home care nurse is visited and they are taking care of his oxygen management. Okay, so home oxygen management. All right, so we have 99503 respiratory care, and then it's giving you some examples. Oxygen therapy, okay, and this is for home visit, so we're going to give it a soft yes before we give it a firm one. Let's take a just take a gander at what else we have. All right. Our mechanical ventilation care. Now we know that was not going on. So we can go ahead and take that off of the list. All right. So this 99503, it's in all of them. So, hey, we know that that is going to be a firm yes, but what's going to drive it? Remember, I said if you need the ICD-10 CM book, then yeah, you've got to use it to help break the tie. All right. And that's what we're going to do in this case. I see you, Janetta. Yeah. All right. So here we go. We're going to take a look here at this first one, I50.1. This is left ventricular failure. Okay. No, we don't have left ventricular failure. No, this patient has congestive heart failure and chronic respiratory failure. Okay. So, no, no left ventricular failure. So, we're going to take that one away. And then we have I50.9, congestive heart failure, not otherwise specified. But this patient has congestive heart failure. Yes, not otherwise specified. And, all right, they have the chronic respiratory failure with hypoxia. All right, this one is acute respiratory distress. That wasn't going on. We know that's not there. Okay, so we like these two. All right, and we love that one. That's in all of them. This one didn't happen. So you can get rid of it. That's respiratory distress syndrome, and that's how you get there. So we're going to give all of them a firm yes. And that's how we got to A. Yes. So, hey, you guys did outstanding. Yes, Janetta, you got it in. See, you figured it out while I was talking. Typically, once you start seeing it up there and we're honing in on stuff, you guys get it. All right. So, if you need to get a screenshot, you may. I am going to pause my screen for a second while I'm back here tinkering. I want to get the one with end-stage renal disease in, so we have enough time to get that in. All right, so we're going to change gears to that one, and we're going to hop on in so we can get it, and we've got time to do it and get out of here. We have A, 90969, B, 90960, C, 90969 times 25, D, 90957. An 18-year-old with end-stage renal disease, or ESRD, patient is receiving dialysis services and has had 2 face-to-face visits with her physician within 25 days. On the 26th day, she's admitted to the hospital for inpatient management without a complete assessment. She remains in the hospital unit until the end of the month. Code the physician services for the 25 days. All right, coders, you've got 2.5 minutes and your time, it begins now. You've got this. Take a breath. Let's do this, guys.
Thank you for watching an AMCI exclusive presentation.
All right, guys, if you hadn't gotten your answer in, slide it in there. Some of you were a little bit undecided on that thing, and hey, I understand. Okay, so we're gonna get you there and go ahead and take a look at this one. Okay, let's go ahead and unpack it because I want us to have enough time before time runs out. This is an 18-year-old end-stage renal disease patient. They are on dialysis. They've had 2 face-to-face visits with the physician within 25 days, but on the 26th day, they've been admitted to the hospital for inpatient management without a complete assessment. Okay, we're coding for the physician services for the 25 days. All right, so in looking at code 99507, this is for monthly services, okay? This is for 4 or more face-to-face visits, okay? And so indeed, this patient has had 2 face-to-face visits and, okay, we can't code for the monthly services because we're shy of the 30 days. So 99507, we're going to take that one away. When we look at code 90960, okay, there we go. So 90957 and 90960, it's for a full month of services, and the patient had less than a full month of services. So 90960, again, this for monthly. All right, so we're going to take 90960 off. Okay, so everybody with me so far? All right, so definitely in this area of the book, you want to be specific in coding what's monthly, what is coded per day. Okay, you want to be specific with that. All right, that'll keep you straight with it. Okay, so for codes 90967 through 90970, and that is our range with the last ones left. Okay, we read here that it is for partial month where there was 1 or more face-to-face visits, and we did have that. We had 2, all right, without a complete assessment. There we go, without a complete assessment, okay? And the patient was hospitalized before a complete assessment was furnished, okay? But right there, we know that grabs it for us. They've had more than 1 and they didn't have a complete assessment, okay? So here we go. We've got 90967. That's our parent. Okay. It's for end stage renal disease. All right. There we go. And it is per day. All right. So here we have for patients 19. This right here, this should be green. Okay. That's good stuff there. Okay. This should be green. All right. So this is for less than a full month. We're coding per day. All right. And so we have this patient. Yes, they are between 12 and 19. This patient is 18. All right. So the thing that gets it between the two, we have to code per day. All right. And so they had the physician services. That's what we're coding for, the physician services before the admission. This is for the physician. They were with the physician within the 25 days. So we're going to code, we need that per day. When you see that per, we know we got to start thinking multiplier if it applies. And in this case, it does. Okay, so per day, you got to start thinking multiplier. We had less than a full month of services. And then we use this if no complete assessment, and we didn't have one. Okay. All right. All right. So outpatient, they haven't been admitted to the hospital. Okay. So that's considered outpatient. If you're not in a hospital, then it's outpatient. Yeah, that per day. Okay. So how is everybody feeling? Good, Renita. All right. I hope you guys are doing well. How are you, Miss Andrea, Aisha, Daryl? I know you said you got it now. Yes, Tamika. Yes, still learning. Yes, we all are. Me too. I'm still learning, even after getting the certification, even after being a CPC. Yeah, still learning, and that's what you want. I'm glad. I see you, Janetta. Good. Miss Mary Rose, I hope you're well. Miss Renata. I keep saying Renita. I know it's Renata. I see 2 A's in there. See, it's my southern accent. I apologize. Outstanding, guys. I see you, Ms. Tamika and Tracy. Thank you guys for all of your participation today. You guys are always just on point and just so willing to work hard, and I appreciate you so very, very much. Okay, so again, don't forget your feedback, your survey. All right, let me know what I can do to continue to make this class worth your while. All right, it is our goal to prepare you for that exam. All right, so help me to deliver quality instruction to you. All right.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.